Have you ever noticed someone you care about acting a little differently than usual? Perhaps their mood seems off, or they are struggling with daily tasks. It can be concerning when those changes become more pronounced and persistent, especially when they seem to point to a significant shift in how someone experiences the world. Psychosis is indicated by significant and persistent changes in a person's thoughts, feelings, and behaviors, often leading to a reduced ability to connect with shared reality. These are not just isolated events, but a noticeable pattern of disruption or decline from their usual self. These patterns typically involve several key areas. First, there can be notable changes in thinking. This might include disorganized thoughts where ideas jump around illogically, or unusual beliefs, known as delusions, that are not based in reality and cannot be reasoned away. For example, someone might believe they are being watched or that special messages are being sent to them through the television. Concentration often becomes very difficult, making simple tasks overwhelming. Another critical pattern involves changes in perception. This frequently manifests as hallucinations, which means seeing, hearing, or sometimes even smelling or feeling things that no one else can perceive. Hearing voices is a common example. It is important to understand that for the person experiencing them, these perceptions are very real and can be frightening or confusing. Emotional changes also play a significant role. A person might show a flat affect, meaning they have very little emotional expression, or their emotions might seem inappropriate for a situation. They could experience extreme mood swings, shifting quickly from irritability to deep sadness without clear external triggers. Finally, behavioral changes are often quite apparent. This can include social withdrawal, where someone isolates themselves from friends and family. Neglect of personal hygiene, unusual or disorganized actions, and a marked decrease in motivation for activities they once enjoyed are also common. These changes are significant because they interfere with daily life, relationships, and responsibilities, signaling that something profound is altering their experience of reality. If you notice a consistent pattern of these behaviors, it is helpful to observe them carefully without judgment. Focus on the facts of what you are seeing and hearing, and consider talking to other trusted individuals who know the person well to confirm if they also notice these shifts. Gently express your concern and encourage them to speak with a healthcare professional, emphasizing that early evaluation can make a big difference. It is important to remember that these observations are for seeking help, not for making a diagnosis yourself. A crucial aspect to understand is the concept of a prodromal phase. This is an early period before the full onset of psychosis where subtle, often vague, changes in thinking, mood, and social functioning may emerge. Recognizing these earlier, milder shifts can be incredibly valuable because early intervention, such as therapy and support, has been shown to significantly improve long-term outcomes and potentially reduce the severity or duration of a psychotic episode. By understanding these consistent patterns of change, you are better equipped to recognize when a loved one might be struggling with emerging psychosis. This knowledge empowers you to approach the situation with informed concern and encourages a timely professional evaluation. Seeking help early offers the best chance for effective management, improved well-being, and a path towards recovery and stability for the individual.